Breaking news just confirmed. The United States Senate has officially passed the Social Security Fairness Act, and for millions of Americans, this could mean a monthly increase of $300 or more in your Social Security check. This is one of the biggest Social Security updates of 2025, and if you receive Social Security, SSDI benefits, SSI payment support, or rely on a retirement check, you need to pay very close attention right now. This change targets two controversial rules that have reduced benefits for decades, and the impact could be immediate once fully implemented. Today on SSN Updates, we're breaking down exactly what's changing, who qualifies, how much more you could receive, and the steps you must take right now to protect your benefits. The clock is already ticking, and missing this could cost you thousands. What is the SSA actually changing in 2025? Let's start with the core of this major change. The Social Security Fairness Act focuses on eliminating two long-standing provisions: the Windfall Elimination Provision, known as WEP, and the Government Pension Offset, or GPO. These rules have historically reduced Social Security benefits for people who also receive certain public pensions. Here's what the SSA has officially confirmed. Under current law, if you worked in a job that didn't pay into Social Security, like many state or local government roles, your Social Security benefits could be reduced, even if you paid into the system through other jobs. The same applies to spousal benefits under the GPO. This means that millions of retired teachers, firefighters, police officers, and other public servants have been receiving significantly lower checks than expected. In some cases, spousal benefits were reduced to zero. With the Senate now passing this legislation, those reductions could be eliminated. In practice, that means restoring full benefits for many Americans who were previously penalized. The real question is, how much more money are we talking about? And when will it actually show up in your check? How much more will you receive in your check? This is where things get very real and very important for your financial future. Early estimates from policy analysts and advocacy groups suggest that affected Social Security recipients could see increases ranging from $100 to over $300 per month. For some households, especially those impacted by both WEP and GPO, the increase could be even higher. For example, Dorothy, 71, from Ohio, worked as a teacher for 25 years and also held part-time jobs where she paid into Social Security. Because of WEP, her monthly retirement check was reduced by nearly $280. If this law is fully implemented, Dorothy could see that amount restored, bringing her closer to the full benefit she earned. Then there's Marcus, 58, from Texas, who receives SSDI benefits and has a spouse eligible for Social Security. Under the GPO, his spouse's benefit was significantly reduced. This change could restore hundreds of dollars per month to their household income. This means that for millions of Americans, this is not just a policy shift. It's the difference between covering basic expenses and falling short. Grocery bills, rent, prescription costs, all of these are directly impacted. However, here's where it gets serious. Not everyone will automatically receive the same increase, and the timeline for payments could vary depending on how quickly the SSA implements the changes. Who qualifies and who gets left out? Now let's talk about eligibility because this is critical. The Social Security Fairness Act primarily benefits individuals who were affected by WEP and GPO. That includes public sector workers who receive pensions from jobs that did not pay into Social Security. If you worked entirely in the private sector and paid into Social Security your whole career, this change may not directly increase your check. However, for mixed income earners, those who worked both public and private jobs, this could be a major financial boost. Here's what the SSA and policy experts are indicating. You may qualify for increased benefits if you receive a pension from a non-Social Security covered job, such as certain state or local government positions. You also earned Social Security credits through other employment. You are a spouse or widow whose benefits were reduced under the GPO. For example, Linda, 67, from California, receives a small pension from her years as a city employee but also qualifies for spousal Social Security benefits. Under current rules, her spousal benefit was nearly wiped out. This new law could restore that income. But here's the problem. Implementation is not automatic in every case. Some recipients may need to have their records reviewed or updated to reflect their full eligibility. The hardest hit in the past are now the most likely to benefit, but you cannot assume the system will fix everything on its own. What Medicare and SSI recipients must know right now. Let's shift gears for a moment because this change doesn't exist in isolation. If you receive Medicare or SSI payments, this increase in Social Security benefits could have ripple effects you need to understand. First, Medicare. Higher Social Security income could affect your Medicare Part B premiums, especially if you fall into higher income brackets subject to IRMA-A, income-related monthly adjustment amounts. According to CMS, even modest increases in income can push some recipients into higher premium tiers. This means that while your Social Security check may increase, part of that gain could be offset by higher Medicare costs. It's not guaranteed, but it's something you need to monitor closely. Now let's talk about SSI recipients. Supplemental Security income has strict income and asset limits. If your Social Security benefits increase significantly, it could reduce your SSI payment or, in some cases, make you ineligible. This is where things can become complicated. The SSA will evaluate your total income when determining SSI eligibility, and even a $100 increase can change your status. The truth is, while this law is a major win for many, it also introduces new financial considerations. You must understand how these programs interact because one change can trigger another. Your action plan. Steps to take right now. So what should you do next? This is perhaps the most important part of today's update. If you believe you are affected by the Social Security Fairness Act, you need to act immediately. First, log into your account at the official SSA website, ssa.gov. Review your earnings record and benefit estimate. Make sure all your work history is accurately reported. Second, call the SSA directly at 1-800-772-1213. Ask specifically whether your benefits were reduced due to WEP or GPO and how this new law may impact your payments. Third, request a benefits verification letter. This document will show your current benefit amount and can help you track any future increases. Fourth, speak with a benefits counselor. Organizations like AARP and your local state health insurance assistance program, SHIP, can provide free guidance tailored to your situation. Fifth, monitor your Medicare premiums. If your income increases, check whether you are subject to IRMA-A adjustments. And finally, do not wait. I cannot stress this enough. Delays in updating your information could result in missed payments or delayed increases. The sooner you act, the better protected you are. Future outlook. What this means for 2026 and beyond. Looking ahead to 2026, this legislation could signal a broader shift in how Social Security benefits are calculated and distributed. The elimination of WEP and GPO has been debated for years, and this move suggests growing momentum in Congress to address long-standing inequities in the system. However, the future of Social Security still depends on larger issues, including trust fund solvency and ongoing budget negotiations. Reports from Capitol Hill indicate that additional reforms may be proposed in the coming years. For Medicare, rising costs remain a concern, and any increase in Social Security income could continue to interact with premium structures. What this signals is clear. The system is evolving, and staying informed is no longer optional. It's essential for protecting your financial future. One thing is certain. The message from the SSA is clear. This is a big win for millions of Social Security recipients, but it comes with responsibilities and deadlines you cannot ignore. Do not wait. Check your eligibility, update your records, and take action today. This could mean hundreds more in your monthly check, or missing out entirely if you delay. If this video helped you understand your benefits, give it a thumbs up and share it with every Social Security recipient you know. Subscribe to SSN updates and hit the bell so you never miss a critical benefits alert. And tell us in the comments, has this change already affected your check?